Right, good evening, everybody. And you're very welcome to Accept, Act, Adapt, a conversation on mental health, a webinar that we're delighted to be hosting here in St. Patrick's Mental Health Service in the run-up to World Mental Health Week, World Mental Health Day next week. The aim of this event is to have a series of informed conversations around the issue of mental health. And specifically, we're going to look at the acceptance of mental health difficulties, challenging the stigma that's associated with mental health, and encouraging people to act in order to support their own well-being. St. Patrick's Mental Health Services is Ireland's largest independent, not-for-profit mental health service provider. It provides inpatient and home care services through its 3 Mental Health Commission-approved inpatient centres. It also has outpatient care and day programmes throughout the country. The organisation has a strong reputation for the provision of recovery-focused, high-quality mental health care and also offers remote access to all its services. The vision for St. Patrick's Mental Health Service is of a society where all citizens are empowered and given the opportunity to live a mentally healthy life. St. Patrick's Mental Health Service's campaign of Accept, Act and Adapt asks us to accept our own and others' experiences of mental health, to act to support our mental health, and to adapt everyday life to enhance and protect your mental health, one day at a time. So this evening, we're going to explore these themes and others over the next hour or so with our panel, who are here beside me, of both professional experts and experts through lived experience. So I'm going to introduce you now to the panel, and then we will have individual conversations with them. So on my left, and making sure that I'm not the only woman on the stage, is Aoife Cullinane, who will discuss her own journey from experiencing mental health difficulties to recovery and mental wellness. Beside Aoife is Paul Gilligan, who is CEO of St. Patrick's Mental Health Services. Paul is Adjunct Assistant Professor in Trinity College Dublin, former Vice Chair of the National Children's Advisory Council and former President of the Psychological Society of Ireland. Beside Paul is another Paul, and I don't think you have to be called Paul or wear a yellow tie, but it seems to be, it seems to be a good idea. Oh, sorry, gold tie. It does seem to be a good idea because next to him is Paul Fearon, Medical Director of St. Patrick's Mental Health Services and Clinical Professor of Psychiatry at Trinity College Dublin. Paul is the current Chair of the Academic Faculty of the College of Psychiatrists of Ireland and has previously worked as Consultant General Adult Psychiatrist in the Maudsley Hospital in London. Finally, at the very end, we have Gary Kiernan, who is Chair of SUAS, which stands for Service Users and Supporters Council, and a social worker, who after becoming unwell and receiving a diagnosis of depression, has spent time in the hospital and has learned a lot about himself and his work and his mental health needs. So that is our panel. Maybe you'd give them all a wee round of applause. Now, after we've had our conversations, there will be some time for some questions and answers. So if you have any questions throughout the event, please feel free to submit them through our Q&A box. Include the name of who you want to direct the question to if you want to direct it to one other person. We'll do our best to get through as many as possible by the end of the event here. So that's the housekeeping done, and we'll get down to business. And starting, as I said, with yourself, Aoife, thank you for being here. You have your own personal story to tell. So can you explain to us where you found yourself when you first realised that you might need support and how you got from there to being here on this panel today?
Feels like, a big ask, to condense about 14 years into a few minutes. But my name is Aoife, and I am someone who thankfully today is living in recovery and in a place of mental wellness. Not perfect by any means, but certainly well. A lot better than when I first came here. It was pretty obvious that I needed help. I was 32 and I was saying it to Gary earlier. So I suppose I'd spent a lot of my 20s struggling with addiction, and I got into recovery. I gave up alcohol and recreational drugs, and 3 years into my recovery journey, most people were taking off, but I started going that way. And I was like, this doesn't feel right, And it became obvious that I had been using substances to medicate my illnesses that I wasn't aware I had, So it became very obvious. I was struggling to work, and my GP recommended St. Patrick's here in Dublin. So at the time I was like, God, I don't think I'm that bad, you know, and that was how I felt genuinely. Like the mention of a psychiatric hospital to me just felt like a big, you know, like a stigma. Like I was like, what, you know, like this seems drastic. And, you know, but the reality was I couldn't work. You know, I was crippled with anxiety, crippled with depression. I had been struggling with suicidal ideation. I mean, I literally felt like just a hopeless case. And so the GP seemed like that she was hopeful. She was like, look, you're not in a place that no one in this planet has ever not been before. You will get well. So I took, I just took the bull by the horns. Then I came up, and that was in 2012. And like I said, I suppose I was lucky. I did have a support recovery kind of system around me with the recovery thing. But like I was very unwell, and I'd been masking a mood disorder. So it turned out that I'd been using substances, you know, to regulate.
All that.
Yeah, and to regulate. And so I suppose, and that's why when Sinead asked me to be involved, for me, the acceptance around that took a long time. You know, I think my first admission, I was in denial. Like I just spoke to everyone about how they were feeling, and I just didn't want to accept. Where I was at. But I must say, like, I think I was in and out of services and in and out of hospital for about 2 years, and I accepted then, you know, what I needed to do, and that was, I suppose, I was diagnosed with bipolar disorder, and again, that was another thing, you know, huge stigma. You know, I was faced with like internalized stigma. I was thinking, oh, like I'll never recover. You know, I had the worst impression. You know, there was a lot of maybe stuff I'd seen on the media, and again. But until I fully accepted that, I was living in denial, you know.
How important was it for you when you said that when you went to your GP, that I think you said she was a woman, that she said to you that this isn't that unusual, that you will get better? How important was that?
Hugely important, yeah, hugely important, because I had never been in this position before, you know. And I think when I heard her say, like, no, this is okay, like, you know, I see people come in here day after day, this is not that unusual, you know. I think at the time it was like, you know, 1 in 10, 1 in 15 people, she was like, are dealing with this, and you can recover. And so it was really, really valuable to hear. And I think then the minute I came up to Dublin here, I'm from Cork myself, and when I came up, I realised...
to guess.
Yeah, the real capital. But when I came up here, I realised as well that while I had maintained, we'll say, like recovery from the substances that were not helping, I had no life. You know, my whole life was built around like working really hard, playing really hard, you know. So when I came in here, then I got supports around, you know, like hobbies, creative supports. Like I started doing songwriting workshops, drumming workshops, the craft room. I really just got in touch with my creative side, and that was something that really led to me starting to create a new life really for myself, and to manage as well, and to regulate my emotions. And acceptance was just, again, about coming out of denial, you know. And it became very obvious I couldn't go back to working in like what I described as the Wolf of Wall Street. You know, it was really hardcore financial sales, 60-hour weeks, deadlines.
This is what you were working?
I was working in banking before that, so I knew I couldn't go back to that. And I suppose that started me then on a whole new journey of personal discovery. And now I actually just a few months ago finished my degree in counselling and psychotherapy.
Well done.
So that was amazing. So now, and again, that was something I felt I'd lost because of my mental illnesses over the years, the chance at a proper education, you know, because I just couldn't, I didn't have the stability to do that when I was young. And I would have laughed it off and just been like, oh, I don't need that. Like, I don't need that. But actually, it's been a great thing. So, yeah, so I'm hopeful.
And proof that it's never too late to reinvent yourself. I mean, I know you're very young, but it's never too late.
No.
You can reinvent yourself at any stage.
Yeah.
What did you, of the supports that you got here, what did you find? Was there one that you could say was particularly really helpful in your recovery?
The most helpful thing was meeting other people.
Right.
Like literally, you know, like the staff were amazing, the supports, like I said, the creative things. But I think meeting other people who were after experiencing like such, you know, mental health difficulties and just that peer connection. And I think St. Pat's for me really encouraged that because, you know, in the creative rooms and in the creative workshops, like we all got a chance to just kind of like talk to each other, you know, and just meet other women and men from all over Ireland who had survived. And I was like, okay, so I'm not the only one in the village, you know, who's not right, like, or, you know, carrying this. So the peer recovery was huge. And I think because of that, then I started hearing of like, you know, different recovery groups. And actually, no, there is one thing, and that was rap for me.
Rap?
It's a wellness, not rapping.
Oh. I thought you meant with a boombox and you were going to start rapping.
That did come into a little bit of it, but yeah. No, so it's like a program called Wellness Recovery Action Plan.
Okay.
And for me, those 12 weeks, I think I did, the first time I did it was 12 weeks, and it just blew my mind because it was the first time I was kind of given agency to, it's like where I created like a wellness plan. So I started to identify like triggers, you know, what causes, you know, my mood to dip, what causes my mood to go high, what causes, you know, a change in my mood. And it just was something that I've returned to over and over again. And I actually redid it during the pandemic, and I'm moving again now currently, and I made out a new rap plan last week. So that's something I think I'd like to do with my new qualification, is to try and start spreading that message in the community, because it's so empowering.
So listening to you talk and describe so well your, I hate the word journey, would you think that now, having come through all of that, that you kind of know yourself a whole lot better than most of us who haven't gone through a mental health crisis actually know ourselves?
I do actually, and that's funny because my cousin rang me knowing I was coming up here today, and she was like, I wish I was so unwell that I could go there. Like, you know, she's like, you've had such a great life because you've faced your challenges head on. And she was kind of saying that to me because she's like, everyone has mental health.
Yes.
But because mine was so, you know, maybe urgent and dramatic that I did need intervention, because of that, like I've gone on a journey that I would not have gotten that chance, you know, to do otherwise. And I think that's something she was saying, like, you know, for example, I'm involved with GROW community. GROW is like a wellness recovery mental health group. And like anyone can go to GROW because we all have mental health, but there's this misconception that people have to have like a diagnosis or be near a hospital. But like, you know, we
or
all
have a major
yeah,
event.
Exactly. And I feel passionate about like, why do we have to wait for it to get so bad that we actually need, you know,
an intervention,
or that we need to be walking around sick for 10 years and not in acceptance in a place of denial, you know? So yeah.
You mentioned earlier on about stigma and about the media and how mental illness is portrayed. How do you think that needs to change in order to reduce stigma?
Yeah, hugely. I think, like, when it comes to the media, for example, like, it's sensational stuff is like, you know, what makes the screen, what sells. So even in my example of being diagnosed with bipolar, at the time, I think there was a show out, Homeland, and the main character had bipolar. But like when it was shown in that show, it was nothing like, you know, I wasn't making these maps in my room and, you know, spinning out for days on end. And I was like, I'm not kind of like her either, you know. So I think like that's not everyone's experience. And I think it, you know, we just need to have a lot of conversations around stigma. Like even I had some people in my family say, like, if that goes on your record, you'll never get a job again. Like, what does that mean? Where is the record? Who are the people looking at it? You know, I was like, that's...
And you wouldn't say that to somebody who'd been through a physical, like cancer or something like that, you know?
Yeah, and we get these things. Or I also had I remember seeing an article about a man, you know, man who'd committed a crime, and it was like, bipolar man did this, you know?
Yeah, so it's linking like, the crime with
and I was like, oh my goodness, if someone reads that, will they think that I'm going to stab someone? And, you know, this kind of like internalized, but it's something that I had to face in my own rap program, was like, how am I stigmatizing myself? And I think like I can clear a room sometimes by being honest, you know, because literally people are just like, she just say she has that, you know? But I think they're the conversations we need to have, you know? Like, and I feel really passionate about it because, like, just recently I hear of too many people not making it and dying by suicide because they feel the weight of these stigmas, and a lot of it is just like bringing awareness. And I think as well for me, like being in recovery as well from addiction, you know, like that, there is a load of stigma around that even. You're like, sure, what's the point of living if you can't have a pint, you know?
Yeah.
What does that even mean?
We have a really skewed attitude towards
little
that
bit,
in this country, don't we? Yeah. How difficult is it for you now, or is it difficult, or have you got beyond that? Is it difficult for you to talk about your own experience?
No, actually, I would say it's not that difficult for me to talk about it anymore now. You know? And I think getting involved with things here in St. Pat's has really helped. I did a lot of writing, like, creative writing to kind of help just bring out a lot of that stuff. And I also did like creative writing workshops, songwriting.
Right.
So yeah, so I think when I brought it out of myself first, then I think the biggest part is becoming strong enough to not be put off by people's responses and just say, look, I know you're a bit afraid about talking about this, but...
And do you see that with people when
I
you start talking in depth about what you went through, that people are a bit...
There is, and I can understand why, because like, some of my family members in the previous generation did have to spend, their life as wards of the state, or they ended up in houses, and didn't make it out. That's, they didn't make it out is another thing. So like, there was a lot of fear. There genuinely was a lot of fear. And I remember when I first started speaking about my experiences, like having to even kind of coax along the generation before me, like, my parents and aunts and granduncles, like, it's okay, like, no one's going to come and take me away.
Right, yeah.
And there is that fear in Irish society because people were taken away.
Yeah.
Or they were locked up, and like...
So it's almost like it's gone into our subconscious.
I think it has.
Yeah, that's a very interesting point.
And that's something I'm really interested about now. That seemed to be a bias that I had the whole way throughout my studies, was like the kind of unconscious stigma that we have even collectively, and the fears, that, for example, like my dad's godmother died by suicide, but they couldn't speak about it openly because she wouldn't have been allowed to be buried, so that was another thing that, and I remember when I first needed help, asking both my parents, is there any mental health difficulties on either side? And they literally were like, no. And by 5 years into my journey, and I had done this family tree, and I was like, really?
Yeah.
But it was just so secret and shameful, and it's actually brought a lot of healing to our family now, because I feel I owe it to the people who didn't make it, or like who did end up being wards of the state. Like, they did nothing wrong, they did nothing wrong. So they just...
And it's something we haven't really as a country confronted yet, in the way that we're starting to confront the Magdalene laundries and stuff like that. We haven't really started to confront that. That's really powerful. And thank you so much for being so honest.
My pleasure.
Thank you.
Yeah, thank you too. It's great to get a chance to just let it all out, because we're all only human and we're all in the same boat. So
that's very true.
Yeah,
that's very true. That's very true. Thank you, Aoife. Thanks a million. Right, Paul Gilligan, CEO of St. Patrick's Mental Health Services. Thank you also for being here. Why are public information campaigns like this one, why are they important?
Well, I think we've just heard the argument for them. I think that a lot has changed over the last number of years. I think we are seeing a massive change in people's willingness to accept those with a mental health difficulty, to accept their own mental health difficulties. I think we're seeing a massive change in awareness. So the conversations are everywhere. But I think where there's a job to be done, where there's a real challenge, is around our accurate understanding of mental health and those with mental health difficulties. I think we still, if we look at the research we've done in St. Patrick's Mental Health Services, answers to questions that talk about recovery and treatment are still somewhat ambivalent. People still aren't convinced that you can be treated and live a good life if you are diagnosed or have a mental health difficulty. So I think to tackle that is really important, and there is still stigma. I mean, you've just very clearly indicated in your own family history, it's not so long ago that people were being placed into institutions. They couldn't get out of those institutions. The law didn't protect them. There was massive discrimination. And we're still living with that history and trying to resolve that history. And of course, that really impacts on people's ability to fully understand what it is to have a mental health difficulty, and the fact that a person with a mental health difficulty should expect to recover and live a good life. And I think that's the real challenge for us.
And do you think some of that stigma then is driven by a kind of a subconscious fear that has come down, if you like, in our DNA of being locked away or put away or never seen again? I mean, do we have to confront that history in order to finally really destigmatise the whole area? I
think stigma exists across the world, so it's not just an Irish thing.
Okay.
But I think that what contributes to that is inner fear, no doubt, and I think we've heard that really clearly. A misunderstanding, a lack of knowledge. I think our history contributes to that. I think that there's also this sense of, and if you look at again our research, it indicates that many people still feel that if they declare they have a mental health difficulty, that it's a sign of personal failure.
Yeah.
The problem is those views feed stigma as well. So stigma is created by that, and I think that's where we have to really start to tackle our inner fears.
Right.
So if I went around the room today and said, do you fear having a mental health difficulty? I think most people would say yes to that question. I think if we ask people, do you really understand and believe you have accurate knowledge? Some may say they have. Many will say they don't, and that includes professionals. And I think that issue of personal failure needs to be addressed really strongly. So I think it's deeply embedded in Irish psyche, but also across the world. What makes it more difficult for us is that history.
Right.
So we as a society haven't really bathed ourselves in glory, to be honest, around how we've dealt with mental health difficulties in the past, and we're still only resolving that, and that does feed the stigma. Now, saying all that, it has changed significantly, and I think there's much more openness, there's much more acceptance, as I've said earlier, but I do think there's still a job to be done.
Yeah, in confronting that history and being open about it and dragging it out of the darkness.
Confrontation's an interesting word. Confronting, sure, but also simply acknowledging that it's still there.
Right.
I mean, it's within our own histories. Now, if you go into schools, they will not know what you're talking about.
Yeah.
But certainly their parents will, and that's recent history.
Yeah.
So we can't ignore it.
Yeah. There is a difference between mental health and mental well-being. Can you tell us about that?
I mean, well, I don't know the answer to that question, to be quite honest with you, because I think it depends. I mean, terminology, and Paul will be an expert on this one. Terminology is really important in this area.
Okay.
But the problem is we all use words in a different way. So many people use wellness to mean mental wellness. Many people use wellness to mean wellness, complete wellness. I think the relationship is a very important one. I think that things we do for our wellness, maybe our physical wellness, help mental wellness, but they don't necessarily mean that they can help you resolve mental health difficulties. They're very good for preventing problems becoming difficulties. I think we have to be clear that when we're talking about mental health and mental health difficulties, we're talking about emotion, behaviour, and I think we need to think about how those speak to each other, how we can change them, how we can tackle them. And then alongside that are all the other wellness activities that we do, the yogas, the mindfulness and all the rest of it. So I think there's a little bit of a difference. I think wellness really is used by most people to mean an overall sense of well-being, an overall sense of being able to enjoy life, be physically well, mentally well. And I think mental health is around the emotional, psychological part of that psyche.
Do you think people sometimes get frustrated when they hear, if somebody is expressing difficulties they're having with their mental health, and that the answer is you should take up yoga or go for a big walk?
Yeah,
I think that kind of makes people feel it minimises.
But I think the more we educate ourselves, the easier it is to interpret messages. I mean, you hear people saying that about physical illness as well. Like if I've asthma, right? If I'm having an asthma attack, then all the running, cycling, and all the rest is not going to help. I need an inhaler. But to prevent me from having an asthma attack, it's helpful to be fit, to cycle, to run. If I have a broken washing machine, I don't really want to hear somebody telling me what I should do with the wash load. I want the washing machine fixed. And I think that's the conversation we need to have. So I don't feel it's frustrating, but I think that it's just misinformation sometimes. So we need to really give people evidence-based information, accurate information, and keep doing that time and time again. And then they're able to interpret those messages themselves.
And how do we help people? Because Aoife expressed in her story how initially she was in denial about the fact that she was having a mental health crisis. How do we get people over that denial so that they would seek help perhaps earlier?
Well, tackling stigma is important because stigma is one of the biggest obstacles to people acknowledging they have a difficulty or seeking help. But I think it comes back to the personal journey. I mean, I think acceptance, and it's a great term to use in the campaign, because acceptance is about being able to look into your own heart and make those tough decisions. I mean, one of the things I say to people who engage with us here is and you'll often hear them say, well, I felt I was at the lowest ebb. Actually, making the decision to engage with services is the first step on the recovery journey. It is a very brave step to make. So it involves bravery, it involves self-awareness, it involves, I suppose, believing in yourself, believing in your own judgment. Now, people will say, well, when a person has a mental health difficulty, that can be very difficult. But we all have an inner resilience. And I think it's being able to tap into that resilience and be brave enough to say, actually, yes, this experience I'm having, it may be a difficulty, a disorder, a mental health problem, or it might be just a distress. But I need to talk to somebody about this. And I think there's a number of things we see people describe to us that they do. The first thing is that most people take action or acknowledge they have a difficulty by speaking to somebody else. And that's about trusting other people. And everybody has somebody who they can trust. And then it's about, I suppose, agreeing what to do next and looking for those supports. And of course, in mental health, you need stamina because, you know, you might be lucky and go to the GP who's really good, or you might go to the GP who says, listen, you're fine.
Yeah.
Everybody has tough.
Yeah.
Go for a walk, go
Yeah.
to the bingo, whatever.
Yeah.
You need to have stamina. You need to keep pushing and being convinced that you need to get this resolved. And the supports might be simple. There might be something in your community. It might be, for example, a self-help group if people experience loss, etc. Or you may need specialist help, and you need to be brave enough to progress that.
Yeah, so I suppose then it also means that there's a job of work to do in education with the medical profession as well.
Well, I won't say anything bad about the medical profession.
Yeah, okay.
Because Paul's on my left side.
I'll ask him that.
I mean, it's very interesting. This panel is really interesting because, you know, I'm not an expert in this area. The people who have experienced mental health difficulties and sought treatment, they're the experts. We can only give our perspective from the professional side, for want of a better word, or from the service delivery side. It's not just medical professionals, it's all professionals. We all come to this with the same experiences, with the same fears, with the same history. So we've got to be brave enough to challenge that. And that is a job for anybody working in this area. So, you know, when I was trained, we still had the old Mental Health Act. So we were still able to put somebody in an institution and leave them there with no review.
Yeah.
The Act only came into being in 2007. I mean, it was passed but not actually implemented. So if you think about that in terms of yes, professionals must challenge their own stigmas, their own training sometimes, their beliefs, their attitudes. It's really important that they believe in recovery, that they believe in a human rights-based approach to mental health care.
Excellent. Thank you, Paul. Thank you very much. That was very enlightening. Now, Paul Fearon, we were taking your name in vain there a moment ago. Anyway, you're medical director here at St. Patrick's Mental Health Services. So tell me, what does your role here involve?
Right. So I'm medical director. I've been medical director for the last nearly 4 years now, actually. I suppose if you had to sum it up, I have a lot of different responsibilities, but my role essentially is by liaising with my clinical colleagues and with my colleagues in management, for example, Paul, our CEO, to facilitate the delivery of high quality healthcare to as many people as we can treat. I mean, that's the bottom line.
Right.
Whatever I can do to facilitate that from a strategic operational viewpoint or an individual clinician or clinical point, I will do.
Okay. If somebody is experiencing difficulties with their mental health for the first time, what's the first step for them? And how do people know that they need professional help? That, you know, it's more than just I'm going to talk to my best buddy, that I might need something a little bit more.
So there are two questions there, and I suppose the answer to one leads on to the other. I think the first thing is, and it's central, and it's been alluded to already, is to communicate. So if you think that something is not right, communicate, talk to someone that you trust. Now that, as Paul has mentioned and Aoife has alluded to too, can be a challenge. Because oftentimes we self-stigmatise. We think the way I'm feeling is to do with something that I'm doing wrong, or that I'm not a good person, or that this will blow over, or whatever. One of the saddest things that we'll see as clinicians is somebody who comes to us for the first time, and they'll have been, in some distress for some time, often years. And it's so sad because often the help is potentially there, but for whatever reason, and we mentioned stigma as being a barrier to a lot of things, but when people do seek help, there are often loads of different modalities now. In answer to your other sort of question from before, psychiatry has changed quite a lot, and the delivery and treatment of mental health has changed an awful lot over the past few decades. It's very multidisciplinary based. We work as teams now, so each team in this service here has doctors, nurses, occupational therapists, social workers, psychologists, pharmacists, and we all work together almost like an orchestra to create what we call an individual care plan. So someone might have a diagnosis, for example, of depression or anxiety, an anxiety disorder, but their journey to that point in time where they've sought help is different for everybody, and the delivery of that treatment might be individualized. There'll be certain parts that are in common, maybe certain programs, certain medications, but there'll be also individual therapies and work that will be done with that person to actually try and resolve the issues for those on an individual basis.
I think when Aoife spoke about her journey here, the thing that I remember probably is the whole kind of process of discovery that she went through. So, and that ties in with what you're saying about an individual care plan. It really is a voyage into yourself, isn't it? And discovering what makes you tick, what makes you not tick, or have a challenge.
It is in many ways, and what was again interesting about what Aoife said was once she'd made that decision and an acceptance, if you like, that she needed help, and when she got into an environment when she was getting that help, one of the helps for her was further communication with other people who had maybe similar and distinct in many ways things, and just sharing that experience and finding both the commonalities and the bits that are different, etc. And that in itself can be so therapeutic. It's interesting, the word's been mentioned already once tonight about resilience.
Yes.
And it gained great currency during COVID, etc. But one of the pillars of resilience is actually knowing how and when to seek help. We're not, to badly paraphrase Simon and Garfunkel, we're not rocks or islands. We're actually, we actually, one of the pillars of resilience is actually knowing how and when to seek help. We don't solve our problems in isolation. We're a communal species. We work together to try and solve each other's problems.
Paul mentioned the other Paul there when we were talking about stamina as well. That you need the stamina to, and I think Aoife mentioned that as well. How do you help people to remain on track? That they don't kind of go, this is too hard, I can't. How do you get them through that get them through the wall?
Yeah. Well, I suppose that there are various ways of going about that. One is, first of all, hopefully the fact that they've sought help and can see the beginnings and the shoots of an improvement gives hope. There's nothing that saps your stamina more than feeling you're banging your head against a brick wall and getting nowhere. So if there's that feeling that progression might be there, that in itself can give you stamina. Pacing yourself, you're absolutely right, Barbara, is really important as well. So taking your time to both reflect on things and also to do the work that you need to do, and also working on yourself. We talk about work in so many other domains in our lives, and I think this is particularly true of Irish people, we're not very good at giving ourselves the time and space and even self-compassion that we should give ourselves. And that's not just for ourselves, it's primarily for ourselves, but it's also for those around us, our families, our friends, etc. So taking things step by step. The road to recovery isn't just being given 7 solutions, go on, do them all.
Yeah.
It may be one step at a time, getting over that particular thing, and and feeling the satisfaction and the benefit and the improvement in quality of life that comes from that thing, and moving on to the next stage, etc. And then there's that wonderful stage of when you are at a stage of recovery, of maintaining that recovery.
That's what I was just going to ask you about. Yeah, I mean, what would you say about how people then maintain that if they recover and they regain mental wellness? How do you maintain that? Or is it different for everybody?
Parts of it are different. So everybody, again, coming back to the individual care plan, if we're in that early stage of recovery, it can be a little bit different. But I'm a big fan. It sounds very old-fashioned and it's simple and straightforward, and I make no apologies for that. There are certain things that we can all do, regardless of what stage of recovery that we're in, indeed, regardless of whether we've ever had a mental health issue at all. And these are things that we know. For example, diet, exercise, getting good sleep, making sure we maintain and nurture our social context. We often talk about exercise and diet and sleep in terms of our physical health, and we know the benefits of those, but we also know now, and the evidence is increasing, that these have incredibly powerful effects on our mental health as well. And the reason I'm such a fan of these, and this isn't rocket science, we all know that we should do these things, and yet, for example, with exercise, people recommend a minimum of about 150 minutes of exercise a week, and that's not going to a gym and pumping iron. It can be walks, and yet, despite us all knowing this and knowing this incredible body of evidence that it's good for us, less than half the adult population, not just nationally but internationally, don't take the minimum amount of exercise that has been shown to improve not only our physical but also our mental health. And the other really powerful aspect of these strategies, if you like, is it puts us more in control of our own health. These are things that we're doing for ourselves. They're not being prescribed in a sense. We can do these. We can't take them for granted, and we can't presume they're going to happen just because we know we're good for them. We actually have to devote a bit of time and thought to doing them. And that doesn't mean spending 3 hours a day doing diet, sleep, exercise, whatever. It could be just making incremental, bit by bit steps to, for example, not have a cup of tea or coffee for if you're used to having one before going to bed, having it a little bit earlier, trying to improve your sleep, or cutting out one of those things in your diet that you know is not great for you and substituting something else, or doing a bit of mindfulness, 5 minutes a day of mindfulness, or arranging to see a friend that you haven't done in a while, looking at your social networks. All of these are evidence-based, robust, recovery-based things that we can all do, both to maintain our mental health, to protect our mental health, and to further on our recovery so that we remain well and the quality of our life improves as a result.
And obviously it'll benefit your physical health then as well.
Well, indeed.
Because as you're describing that, I'm thinking of, that it really involves a lifestyle overhaul. I'm diabetic, and 5 years ago I had to do exactly that, the lifestyle overhaul, in order to stay well. And what you're describing is very similar.
And I bet you feel not only the mental health, but also the physical health benefits. In fact, they kind of overlap, don't they?
They do, yeah. And I mean, I'm often saying to my girls that, I was turned off exercise in school, as I think a lot of us possibly were. I still don't ever go, ooh, yippee-doo, I'm going for a walk, but I never regret it when I come back.
Exactly.
And it's making that, I have to do it, and I'm going to do it, and I go out with a long face, but I normally come back with a smile.
And those are often the ones, the exercise bouts that you appreciate the most, the ones where you think, I don't want to do that, or it's raining outside, or I'm a bit tired, I'll do it tomorrow, and you go out and do it, and the sense of satisfaction, and also, in a sense, control that you get, because you know this is the right thing to do, and you did it anyway, even though you didn't feel like it. They're often the ones that are the most powerful.
And also just being out in nature, I think, as well, as you get a great buzz out of kind of and watching the world around you. This webinar, and I know the service here is focused very much on a world where everybody takes action for their own mental health. What would that look like if everybody, not even people who are experiencing a major crisis, but if all of us had a different attitude to our mental health, would that make our society hugely better?
I mean, I think it would. I mean, we've covered many of the aspects of that in some extent, but I suppose, number one, communicating more. I think COVID helped that to some extent, because talking about our mental health suddenly became okay, partly because all of us were in the middle of this very stressful, prolonged, uncertain period. And hopefully, in a sense, part of that spirit is sustained and maintained. I know a lot of things that were good about COVID, not that there were many, but that we should cherish the ones that were. Hopefully they don't regress back now that COVID is, if not behind us, it's certainly receding. I think keeping up that communication, talking to each other about things that matter to us, whether it's our physical health, our mental health, whatever. And I suppose also those things, just living a better life, just taking the time to nurture ourselves, especially as Irish people. I think we feel guilty, especially if you're in my generation, about our upbringing. We weren't taught to kind of nurture ourselves. It was almost thought of as a bad or an indulgent thing. That's entirely wrong. We should be giving ourselves the compassion that we're due, the pat on the back. When is the last time you said to yourself, actually, I'm a good person because I did that yesterday? We tend to concentrate too much on the negative things. And that does have a detrimental effect on our overall
that's
health.
really interesting. Self-care and compassion to ourselves. Very good. Thank you. Thank you very much, Paul. Now, last but by no means least, there at the end is Gary Kiernan. Gary, you're a social worker. And after you became unwell and had a diagnosis of depression, you spent some time in the hospital. So thank you very much for being here. You've an interesting and kind of dual perspective because you're both a former service user as well as being chair of the Service User and Supporters Council. And you work yourself in a caring role, I think. So can you give us a little bit of the background on yourself and what you do?
Sure. So, I mean, what everybody has said, I can associate with, and it's I suppose it's really good to be able to talk because I know that when I was first ill and I first came to this hospital and a certain doctor took me under his wing, that it's the last thing I wanted to do. I remember being admitted into the unit, Dean Swift, and I just pulled the curtains, you know, around the bay, pulled the curtains around myself, got under the duvet, and I just didn't want to know. I really felt that I needed to hand over everything to somebody else, you know, that I really needed to because I came to the stage that I had suppressed, I suppose, a lot of what was going on for me, and I hadn't talked about it. And I think it was difficult as well because of the work I do. Yeah. You know, being a social worker, I had this feeling that I would be somehow inadequate if I was to say that I had a mental health illness or that I suffer with depression. So my diagnosis is severe recurrent depression. But for that reason, and also I was fearful because I was a father, and I was fearful as to not being able to be there the way I thought I should be there for my children. So all of these things over the years were in my head, but I remember, you know, just coming to that stage and going to my GP, and then I was a short time in Waterford Regional, and then I got up here, and I think I just spent the first 4 or 5 weeks just with the duvet over me. I just didn't want to know, you know. And we talk about, you know, the themes. I was thinking about the themes, and what comes into my head is the act. And for me, the act of coming in here was the first step, as Paul has said. And then also medication. I remember the doctors, or some saying to me, maybe Paul said to me, you know, you'd be here for 4 or 5. And I was waiting to hear days. And he said, weeks. I go, Jesus Christ, I'm not that sick. But my only experience of hospital previous to that was, you know, I think I had my appendix out or something like that, and you go in for 3 or 4 days. I didn't know anybody else that goes to hospital for 4 or 5 weeks. You know, what is wrong here that I had to be kept? But that's how long it takes sometimes for the medication, and that's the role of the medication, to pull you that little bit up out of the hole, so that you're able to start climbing out of it yourself. Just it gives you that little bit, and that's what it did for me. And that was the first act, was coming here. But I suppose what prevented me coming here was that self-stigma, and along with fear of somehow being viewed differently. And the fact also, when I still work for TUSLA, you know, the Child and Family Agency, and I always worked in child protection. And one of the reasons for my trauma was sexual abuse as a child. And it was hard for me to say that out loud. Yeah. It was hard for me to say it out loud for lots of reasons. Ashamed of it, feeling dirty about it, but also feeling again that I'm making myself vulnerable as a professional. Yeah. You know, that I would be seen somewhat enabled to be a competent professional, caring healthcare professional. If I say, yes, you know, I was abused. And having then, I suppose, while here, and like Aoife said, it's a number of admissions, you know, and I
Yes.
think anybody here or listening will share that. I think for most of us, it's very few that will come here just once, you know, and that is the act, because each time I came, I was unveiling another bit more, unwrapping another bit more for myself. And each time I came, I could probably think of, you know, milestones, you know, and certainly one of them was around saying, yes, I was abused. And I used to say to adults who, you know, would say they were abused as a child and they blamed themselves. And I was very good for saying, now, you know, you should look at it. You're looking at it through the eyes of an adult. You have to look at it through the eyes of you when you were a child. And I was great at saying that. Did I believe it? Did I do it to myself? I didn't, you know. Another word that was mentioned was compassion.
Yes.
And I needed to give myself a big hug. I needed to wrap myself around a hug and to really allow myself to be vulnerable to other people, whether it be other service users, other friends that you make here, or whether it be the doctors or the nurses, you know. And they do, you know, I know when you're going through the illness as well, you can be angry, you can be, you know, and sometimes you can think your doctor is the worst person on earth, and you know, so you need people to hold you unconditionally as well, you know, because it isn't easy. So that's the act, and I suppose also coming on from that then is the accept, and I had to really accept that I have a mental health illness. I remember the doctor, because when Professor Fearon moved on, I came under Dr. Lucy, and I remember Dr. Lucy saying to me, you know, you have a terminal illness. And I kind of, you know, that's cancer, something. But I know, you know, and I'm the sort of person, I think about things a lot. And I think what I understand is that I have to accept that I have an illness that is probably going to be with me for life. Doesn't mean I'm going to be unwell all of the time, but it's something that I need to mind. And whether that's by taking medication, which I do, then and by becoming aware, I suppose, of days. I love it when people put up the things on Instagram about getting to the sea and doing the cold water swim. For me, getting into the shower is my equivalent of a cold water swim. Yeah, or getting out of the bed can be my cold water swim. Yeah. And you know, that doesn't ever stop.
Yeah.
I would safely say once, maybe twice a week, I would wake up in the mornings and probably feel like that. Right. But now I know that, okay, if I need to take another half an hour in bed, that's not the end of the world. Yeah. If I need to do that, or if I need to say, I'm not in the humour of having a shower today, okay. You know, I'm from a family of 17, and we got a bath once a week. And you were in and out of the same bathwater as the 15 siblings before you and the neighbours, you know. So we never.
Yourself and Paul, you're painting a terrible picture of back in the day.
You know, but you know, so it is, and this is a journey. You know, being here today and being chairperson of the SUAS Service Users Board is it's, you know, it's still part of the journey. I feel very, I suppose, act and then adapt. And that adaptation is the acceptance, is knowing when I need to take that extra half hour. Or I have the type of personality where I need to, sometimes if I'm in a big crowd of that, I may need to just take 10 minutes on my own, go out and that. And now I know that, and that's okay.
So it's like what I said to Aoife, it's a real journey of self-discovery as well.
Massively.
In order for you to be able to
and the difficulty, I think, with it is, the analogy I use is that, because the part of us, and Professor Fearon be more, but my understanding of how depression, for me, is about something about the wiring in the brain and an imbalance of electrical signals and all of that goes on. And yet, the brain is what we need to pull us out of it. So you have this thing that the part of our body, the organ within our body that is unwell, is also the organ in the body that we need to be well. If you get them out. And I think that's a little bit like trying to, maybe it's like trying to service a car while the engine is running. You know, in that kind of way. So, yeah.
Excellent. Thank you. Thank you very much, Gary. Again, very illuminating. Okay, I think we will have some time now for some questions. So can we, if anybody here in the audience has a question, if you just raise your hand and somebody will collect your question and hand it, and we will pass it on to the relevant person or people here on the panel. I think tonight's discussion has been, certainly for me personally, very illuminating. And I think very interesting, the personal strategies that you have to have in order to remain well are very important. Right, okay. First one here. How much undiagnosed mental illness do the panelists believe there is in this country? And how much of that do they believe is trauma related? In other words, childhood trauma. And I guess that's a question maybe for you, Paul, is it?
Sure, I can kick off with that. The truth is we don't know. If it's undiagnosed, we don't know. We can estimate. I think what we can say is our people are coming forward earlier than they used to do 20, 30 years ago. There are more and better services there than there were. But the truth is we don't know. They've done big epidemiological studies in the States and in Scandinavia, where the only way to actually find that out is by knocking on doors of every door and actually doing a questionnaire. And there is some undiagnosed illness. In terms of trauma, I mean, I don't want to overstate it, but having said that, I think trauma, and of course the definition can be problematic, but trauma in all its forms is certainly one of the many risk factors for mental health disorders, and unrecognised trauma and trauma that goes on and that's kept sort of inside there like a pressure cooker can be very destructive. And I think, you know, as time's gone on, particularly over the last 5 or 10 years, our understanding and also our acknowledgement that trauma is a risk factor, for want of a better word, and indeed in itself is an issue for people. We're acknowledging that more, and indeed, I mean, in St. Patrick's we have we deal with trauma that quite regularly. We have groups that deal with trauma. So I'm not sure if anybody else wants to come in on that, but
yeah. I'm going to go on because we've got quite a few questions here, so we'll try and get through as many of them as we can. I think this one is interesting, and I'm not sure, maybe Aoife, if you'd have a view on this. What impact do the panellists believe that social media is having on people's mental health, particularly younger people?
Oh, huge.
Yeah.
I feel it's huge.
Yeah.
Like, one of my first things that I did was come off social media, and actually one of my early warning signs is if I reactivate a social media account, because I feel social media is like a no-no. It just triggers, you know, maybe, for me anyway, I missed out on maybe a lot of like life markers.
Yes.
So if I see someone, you know, with their second child at a christening, and I can start going, oh God, I didn't get to do that, or, you know, and it can just become, like,
stick to beat
but I
yourself
also
with.
see that because of the healing I've had to do, like when I see younger women and men, you know, living their life through this lens and not realizing that maybe what they're seeing is not a correct portrayal of that person's reality. And like, I recovered from an eating disorder as well in my 20s, and I know that was before the social media, and I'm so glad I didn't have social media to contend with, because people are using filters and able to alter their bodies, and, you know, that's my own personal opinion. I stay away from social media.
Do you have anything on that, Paul? Would you?
I think the truth is social media is a reality for us all now.
Yeah.
And it comes back to education. I mean, Gary will know from working with vulnerable young people, it has a massive impact on young people, because what's happened is social media suddenly became part of their lives without any preparation, without any education.
Yeah.
But I think the only way to deal with it is to educate young people on its appropriate use and on understanding what they're seeing. And I think that's happening. But I think if we don't do that, then there's real vulnerabilities around their mental health care, their mental health.
Of young
but
people.
of young people, yeah. But I do think we have to accept that it's now reality of life. So we have to educate and support.
Very good. I'm going to go on to another question, and this is for Paul Fearon. How can employers recognise the signs of mental health crisis, and how can they safeguard their team's mental wellness? It's a big question.
Yeah, it's a big question.
Yeah.
I mean, I suppose a healthy working environment is important for all of us. So employers should be looking at how they can promote that for all their employees. Whether they should be looking out for it, it sounds a little bit kind of Orwellian, but I mean, I think people should be supporting each other at work. Line managers should be doing their line managing, which doesn't just involve, are you doing your work, but how are things going? What are the challenges? How can I help you? I mean, that is the basic question that a line manager should be at the back of their mind. How can I help you do what you need to do well and happily? So, and there's no one-size-fits-all solution to this because there are different employers, and different types of work.
Yes.
But the basic thing is to create an environment at work which is non-threatening, which is egalitarian, where people feel comfortable communicating with their colleagues, their line managers, people above them, people below them. Again, it comes back to communication largely.
And recognising that we're all different.
Yeah.
Okay, thank you for that, Paul. There's another one here which I think is important. How can we gently bring a family member out of that denial that they are in a mental health crisis? Is it possible, or do they need to recognise it themselves? And I'd imagine this is a common kind of issue that families are dealing with. Can you push somebody into that, or do you have to wait until they...
I mean, ultimately, the final common pathway is that the person themselves needs to acknowledge it. But that doesn't mean that the family or the friends or acquaintances, or maybe somebody that they only know somewhat well, it may not be somebody who they know intimately well. That doesn't mean they have no role to play, because it may well be that it's on the 7th or 8th time that somebody, and it might be a different person, mentions things just aren't quite right, or has something changed, or whatever it might be. You can't push someone into things, but I think keeping a compassionate, supportive, well-judged communication line open, and for that person to know, even if they disagree with you and don't think there's anything wrong, that you haven't closed down a conversation by being coercive or by being too dogmatic. That listen, if things change, come and talk to me. I'm there and I'm available. You may not even need to say it verbally. It might be just in your demeanour, but keep the communication line open. But ultimately, hopefully that person will eventually see that enough people around them that they know and trust might be concerned for them, and that there's something to it.
Yeah, and might start to open up and talk about it.
Yeah, it's a patience game sometimes,
Yeah, that's one of the themes I think that is coming across very much this evening. Somebody else has asked, Aoife, you've mentioned peer recovery and the power of meeting people with similar experiences, and this person asks, how can I find people with similar experiences? But I presume the answer is through a service like this, or... Yeah,
and also online, Mental Health Ireland has some very good resources. Grow Mental Health Community, meet all over Ireland. It's an hour-and-a-half meeting, and it's very action-based, where, I've been going for 5 years now. I pick a goal every week. And it's like I have a book full now, and I've actually achieved things in the 5 years. We don't just kind of sit around not taking action. Also, I would recommend, there's RAP groups run all throughout the country. The programme I was talking about.
Oh, that's WRA.
Yeah, Aware, isn't it? I've literally been everywhere, because they're there, they're there for the taking. And Aware is very good as well, and they run groups. But when it comes to peer supports, I think one of the Pauls mentioned as well, it could even be, that maybe there was an unresolved grief in yourself, and there's grief support groups. Even I know, some people maybe who are raising children who've difficulties. Just there's so much going on in the community, and I think when I first realised I was unwell, my world was actually quite small, but now my world is huge, And the Recovery Foundation, I believe, someone said to me, make your recovery foundation as large as you can, because then it's your base is really strong. And so I would say Mental Health Ireland, just Google, but be discerning as well. If you get to a place and you feel it's not for you, I had to knock on a few doors and find the right group for me.
Yeah.
So, just because we have an illness doesn't mean we can't, like,
You're not
you know,
homogenous.
yeah, exactly.
Yeah.
We can just say, actually, I'm not really vibing with that place, you know. So
Yeah. Okay, this is another one maybe for one of the polls here. This will probably be the last one we get to, but what are the top 5 things you recommend that anyone can do to mind and support their mental health? I know, Paul, you mentioned a few looking after yourself, but maybe we'll recap them again of 5 things that people could do to mind their mental health.
Okay. Have a routine. Routines when are particularly important. It sounds paradoxical, but it's true. When things are a bit out of control, having something to fall back on, like an anchor, like an island that when everything else appears to be out of control, whatever it happens, I'm going to go for my quarter of an hour walk or 20-minute walk. I can leave everything else; it can wait. Leading on from that, exercise. It's so powerful for our mental health. And again, I'd stress that doesn't need to be intensive, long bouts of exercise in the gym, whatever.
A stroll.
In fact, you mentioned walking before, Barbara, and the evidence for the incredibly powerful effects of just walking are getting stronger each year. You know, it's extraordinary. So there are very few people that can't take some form of exercise.
And I think it's important to reiterate what you just said. It doesn't mean you have to don lycra and walk at 100 miles an hour.
No.
It means putting on a pair of runners and going for a stroll.
Indeed. The diet I mentioned, and I won't expand it, other than say we kind of all know from a physical health point of view what's good for us and what's bad for us. You know, fresh fruit and veg, less processed meat, all that kind of stuff. But reducing, if we'd been talking about this 10 or 20 years ago, we would have been talking about low fat and all that. It's now carbohydrates, sugars, starches, so potatoes, pasta, fizzy drinks, etc. I reduced my carbohydrates about 2 years ago, and I found the effects on just my demeanour and I wasn't getting these sugar cravings and highs and lows. You know, that I might have been getting before. I was less irritable, I was sleeping better. Very powerful effect. Sleep, again, sleep hygiene measures are very important. Nobody gets a perfect night's sleep every night, but just trying to attain sufficient sleep is very important for our mental health as well as our physical health. And mindfulness, yoga, and actually taking the time to just evaluate and to take the time to do a little bit of a few of these things each day. It doesn't have to be everything every day, but just having that space in your life to look after yourself. It is about self-compassion again, you know, and that has knock-on effects, not just for you, but for those around you. If we were all doing that, it would be like these Venn diagrams overlapping and we'd all be in a better place. Not a perfect place.
A lot more zen.
Yeah, I mean, and we're not talking about perfection here and happiness, but we're just talking about, you know, coping better with things. You know, life is full of stresses. We're never going to get rid of that. We're not talking about that, but coping better, having a better overall quality of life.
Okay, great. That's wonderful. Well, I think our time is just about up. Thank you for that. And you got to 5 without batting an eyelid. I always think they're kind of hard questions sometimes when they're thrown at you. I want to thank all of our speakers for their insights and views around Accept, Act and Adapt. Aoife Cullinane, Paul Gilligan, Paul Fearon and Gary Kiernan. Thank you very, very much indeed.
Thank you.
I want to thank everybody who's here in the hall and who's watching this webinar live, or if you're watching it at some stage in the future. I hope you found it enlightening and positive. I just want to finish by telling you about an innovative projection installation designed in collaboration with Soft Productions, taking place in the Townhouse in Arnott's on Henry Street in Dublin from Monday the 9th of October to Friday the 13th of October, that's next week, from 11 a.m. to 4 p.m. This installation will enable anonymous self-expression by taking the words from members of the public and transforming them into moving and impactful visual displays. The townhouse space is located on level 3 in Arnott's, and this is an innovative way for St. Patrick's Mental Health Services to challenge the stigma that we talked about earlier, among other things. You can also follow St. Patrick's Mental Health Services on social media, as further information on this campaign will be shared there. And that is the end of that. Thank you very much for joining us. Good night.
Thank you.